Students, family members, friends, faculty, staff, distinguished guests, welcome to the University of Minnesota School of Nursing 2025 Fall Commencement Ceremony. In gathering, we recognize that the University of Minnesota Twin Cities is built within the traditional homelands of the Dakota people. We acknowledge and honor the peoples on whose land we live, learn, work, and today celebrate as we seek to strengthen our relationships with our tribal nations. We also acknowledge that healthcare system meant to protect and heal people has supported structures of racism, structures causing ongoing trauma and health inequities. And most importantly, we acknowledge that words are not enough. We must ensure that our institution provides support, resources, and programs that increase access to all aspects of higher education for our American Indian students, staff, faculty, and community members. Today, we are grateful for you. We're grateful for our students, families, and friends who have traveled to campus on, yes, this blustery December day to attend our ceremony in this magnificent auditorium. And we are honored that so many family and friends from around the country and the world can be with us via the live stream. It's a day of celebration, a day acknowledging the outstanding academic accomplishments of the students seated before all of us, the class of 2025. I ask you to take a moment to share our appreciation for your parents, your spouses, your partners, children, friends, mentors, tutors, scholarship donors, classmates, and others who have impacted your academic journey. Let's show our appreciation. Based on previous ceremonies, we realize we have many nurses in this audience. Nurses that are or have served our communities by advancing health and delivering health care, and who have inspired and supported today's graduates as well. We ask that all nurses in attendance please stand if you are able so that we might share our appreciation for you. We are grateful to each one of you and all of you as a collective in unwaveringly placing people and health first. You establish and maintain the legacy of nursing being the most trusted profession. Students, we celebrate the remarkable commitment and dedication your professors, instructors, and preceptors have shown in helping you achieve your degrees and reach your fullest potential. Please join me in sharing gratitude for their commitment to your success. It is now my distinct pleasure to introduce University of Minnesota Executive Vice President and Provost, Gretchen Ritter. In addition to serving as Provost for the Twin Cities campus, Dr. Ritter is the Chief Academic Officer for all 5 campuses of the University of Minnesota. She joined the university from Syracuse University this summer. And this, by the way, is her first University of Minnesota commencement ceremony. We are incredibly grateful to have her with us. Please join me in welcoming Executive Vice President and Provost Gretchen Ritter.
Regent Gully, Dean Delaney, members of the faculty, graduates, and distinguished guests, I am honored and delighted to be here with all of you this afternoon to join in celebrating our wonderful students. As your Executive Vice President and Provost, I want to begin by saying congratulations to you, Class of 2025. You have put in long hours and tremendous effort to achieve this goal, and I am happy to be here with you today as we celebrate the culmination of that effort. I would like to acknowledge also the College of Nursing faculty and staff, whose dedication to the profession and to student service have guided and prepared today's graduates for this occasion and what awaits them on their career path. Let me also recognize all of the family and friends who are here supporting the graduates. It takes a team to educate a health professional, and all of you are integral members of that team for your graduates. Graduates, it is clear that you are graduating with a superb education that will prepare you to meet the challenges of the future. The School of Nursing is the oldest nursing school in the country attached to a university and has several nationally ranked programs, including the Doctor of Nursing Practice program, recently ranked #4 in the country by U.S. News and World Report. The school has also been awarded the Health Professions Higher Education and Distinction Award from Insight into Academia for the 10th consecutive time. And though the School of Nursing is among the oldest, it is also among the most forward-looking and innovative in the country, with its focus on health informatics and interprofessional approaches to health care. But I am sure that I don't need to tell you this. You have seen the evidence of the School of Nursing's excellence for yourself in the knowledge, experience, and mentorship that you have received from our outstanding faculty. Those of you graduating with your Master of Nursing degrees today come from remarkably diverse educational and professional backgrounds. Whatever your background, the knowledge and skills you have brought with you to the nursing program will inform and serve your professional career in myriad ways. I am sure that the past 16 months has been a time of great intensity for you. We are proud of your drive and your commitment to your field, a field in which you are so needed right now. I would also like to recognize the Doctor of Nursing Practice graduates who have chosen to walk today. You are now poised to transform the health and well-being of communities throughout Minnesota and beyond. At a time when we are experiencing a national shortage of healthcare professionals, nurse practitioners are often the primary healthcare providers, especially in underserved communities. I look forward to seeing all of the ways that you will inspire and drive change through your advanced knowledge, advocacy, and innovation. America's health systems need leaders like you. So go forth with confidence that the University of Minnesota community stands with you. To all of our graduates, I know the exemplary education each of you received involved learning with, from, and about other professions. And you can say with confidence that you are going into the world prepared to work in interprofessional teams that will improve the health of people, communities, and the population. On a personal note, I would also like to take a moment to acknowledge my 4 aunts who were nurses, Aunt Sally, Joyce, Anne, and Marge, who taught me that care and compassion are central to leading a meaningful life. On behalf of the University of Minnesota and the Health Sciences programs, I congratulate you on your achievement and wish you the best as you take the next step on your professional journeys. Congratulations.
Provost Ritter, I want to thank you for your comments, for your support for the School of Nursing and our interprofessional activities. I also want to thank you on behalf of the school for your exceptional listening capacities, your fast ramp up in such a few months, and the change you've already fostered. Thank you. Well, graduates, today you're earning more than a diploma. You are now entering or taking the next step, as we mentioned before, in America's most trusted profession. And you know what? You are inheriting that legacy. In 1909, the physician Richard Olding Beard, here at the University of Minnesota, helped found our School of Nursing. Not just to train nurses, as was the practice at that time, over 100 years ago, rather to educate them. Beard's foundational belief was that through education and cultivating what he called the educated spirit of the nurse, we would empower society to achieve 3 central things: recognize the worth of human life, conserve human health, and provide for social justice. He was a true visionary, and he was a staunch advocate for nursing's potential. That said, I'm not so sure he could have imagined what your class of 2025 would bring to nursing and how you will carry forward the founding principles of recognizing the worth of human life, conserving human health, and providing for social justice. I don't think Beard would ever have imagined that this school would offer the Master of Nursing program that welcomes students with degrees in other fields. And after 16 intense months, they are ready for national exams required to be a registered nurse. I don't think Beard would have imagined that in addition that being prepared for this exam, you are also poised to lead and advance the profession, health, and the breadth of nursing confidently. Allow me to share the majors and in some instances graduate degrees of your class. Anthropology, art, biochemistry, biochemistry and molecular biology, biological sciences, biology, biomedical science, electrical engineering, elementary education, environmental studies, exercise science, gender studies, genetics, geography, health science, history, human development, international studies, kinesiology, laboratory technology, management. The list goes on. Neurobiology, neuroscience, nutrition and dietetics, nutritional sciences, psychology, public health, science, technology and society, and sociology. You represent an incredible breadth of knowledge, and you each have brought this incredible breadth to our school. It deepens our capacity to deliver truly patient-centered, team-based care across all ages and settings. And the diverse perspectives that you forged before nursing school will help you bring increasing insights to every challenge, and again, strengthening nursing from within. And we embrace your richness and diversity. You strengthen not only each other, you strengthen our school during your time here by fostering a dynamic learning environment that benefits us all. And let me share something we are consistently hearing from our partners. It goes like this. Our Master of Nursing graduates have the ability to make an immediate and profound impact. Employers repeatedly tell us from day one, you bring not only clinical readiness, but you also bring a unique blend of critical thinking and adaptability, directly stemming from your multifaceted academic journeys. I hope you'll go forward knowing that you are truly prepared to lead with both head and heart, and are ready to shape the future of health for everyone, our families, our communities, our society, and our planet. As Richard Olding Beard might have just been blown away in seeing you, who have already held baccalaureate and graduate degrees in other fields, seeing your passion to become nurses, I think he would have been equally floored and delighted by the Doctorate of Nursing Practice degree, which helped further the educated spirit of the nurse. As I shared earlier, Beard's core belief was that well-educated nurses could profoundly contribute to public health, social justice, and moving beyond mere test-based training, moving to embrace the critical thinking, the scientific understanding, and yes, ethical commitment. What embodies these principles more than the Doctor of Nursing Practice degree? It prepares nurses for advanced practice and leadership roles, enabling them to design and implement evidence-based solutions to very complex healthcare challenges, drive interprofessional collaboration, and yes, champion whole person, equity-centered care. Beard would see the DNP graduates as the natural inheritors of his legacy, translating his profound vision into tangible, impactful action for the benefit of all, and especially the underserved. So, class of 2025, embrace the educated spirit within you and combine what you've brought to nursing with what you received at the University of Minnesota School of Nursing. It all blends in your professional trajectory. It all empowers your head and heart connection. You will go forward and you will continue to shape nursing's future. You will advance equitable healthcare and improve the health and well-being of all and our planet. So on behalf of the university and the faculty and staff of the School of Nursing, we share a sincere congratulations to each one of you on earning your degree. We extend our care, our love, our gratitude, and our utmost confidence in each one of you. It's my privilege to introduce our commencement speaker. Melissa Fritz, who comes from one of our most profound partnering systems. Dr. Fritz serves as the Vice President of Patient Care and Chief Nursing Officer at Methodist Hospital. Methodist Hospital is part of the Health Partners system. In this executive role, she provides strategic direction and administrative oversight for inpatient nursing and all patient care services. She's a dynamic healthcare leader. She's a recognized change agent, and she brings a wealth of experience spanning clinical operations, clinical care, nursing leadership, quality improvement, administration, and yes, professional development. A little bit about her background. Melissa earned her Doctor of Nursing Practice degree from Baylor University, her master's degree in the Adult Health Clinical Nurse Specialist specialty here at the University of Minnesota, and her bachelor's degree from Marquette University. She is certified in executive nursing practice. She holds the fellow designation from the American Organization of Nursing Leadership, and Melissa currently serves as president-elect of the Minnesota Organization of Leaders in Nursing. So class of 2025, please join us in welcoming a phenomenal leader, Melissa Fritz.
Good afternoon, Dean Delaney, esteemed faculty, families, friends, and most importantly, our nursing graduates. It is a profound honor to stand before you today to celebrate this momentous occasion. Today is a day of celebration and also a day of reflection. For many of you, this is a culmination of years of education, sacrifice, and hard work. To our graduates, those earning a Master of Science in Nursing and your Doctor of Nursing Practice, you have achieved an extraordinary milestone. As you reflect on this journey, it's clear that your path to this moment was not easy. All of those early morning and late evening clinicals, the practicums, the long hours spent studying at home, in the library, in the coffee shop, the countless times you all logged into the computer right after you got home from work, that was no small challenge. You all sacrificed time with your families and your friends, and you probably burned the midnight oil from time to time to get those papers, those assignments, and those discussion boards done by 11:59 p.m. I never did that, but all of that hard work has paid off. You are here and you're graduating. So today we gather not just to recognize what you've accomplished, but who you've become. You are a nurse, and what a privilege that is. I am so excited to personally see, hear, and watch the difference that you all make. To our master's prepared nurses, you are joining a field that, while rooted in tradition, is constantly evolving to meet the demands of today's world. What you bring to the table is invaluable. You bring fresh perspectives, creative problem-solving skills, and the ability to approach nursing challenges with a different lens. You will have the opportunity to draw on your professional experience and contribute greatly to our profession. To the students who are completing the Postmaster's DNP program, you are not only implementing evidence-based change, you guys are leading it. Whether you are caring for patients and improving outcomes in clinics and communities, or transforming quality in hospitals, or maybe influencing public policy, you are nurses who are going to drive change. To our DNPs with a focus on leadership, please know that being a leader within nursing is a privilege. You are the vital link between the bedside and the boardrooms. And to our DNPs with a focus on informatics, you will shape the future of the care that we deliver. You, our graduates, are the future of nursing, and we need you to know that now more than ever. I thought long and hard about what I wanted to share with you all today. As I reflected, it was evident that I have personally learned the most through listening to others, listening to their stories, and learning about their journeys. So I'd like to take a few moments to share my journey in nursing with you. During my undergraduate program, I quickly learned that I wanted to be a cardiac nurse. The heart, the conduction system was just absolutely fascinating to me. My first job was here in the Twin Cities. It was on a cardiac same-stay unit. At about the 6-month mark, I was asked by my leader, Mary, to be a preceptor. I did not think I was ready. However, I said yes anyway. And it was one of the best things that I said yes to. To be able to guide, educate, and precept newer nurses was incredibly fulfilling. My leader, Mary, saw something in me even when I didn't. I ended up precepting many nurses and interns. One of the first interns I precepted, her name was Rachel. She was a natural leader. I did not realize the impact that I had on her until about 15 years later. She recently approached me at a nursing leadership conference, and we reconnected. She thanked me for everything I had done and shared the impact that I had on her all of those years ago. I was so glad I had said yes to precepting. Throughout my years as a nurse on that unit, I had always asked a lot of questions. In healthcare, there's always so much to learn. I would listen to anybody that would teach me. And then one day, our medical director, his name was Dr. Tolman, he approached me and he said, "Melissa, you're really great at asking a lot of questions." And then he asked if I would help him abstract and review patient charts to ultimately develop what we have today known as the sepsis algorithm. I immediately jumped at the chance, and my leader allowed me to abstract the charts part-time and then also work on the floor as a bedside nurse part-time. Around the same time, a clinical nurse specialist, or CNS, by the name of Margot, who I had greatly admired and respected, she approached me and she said, "You seem really interested in quality, and would I ever consider going back to school to be a CNS?" At that time, I didn't know what a CNS was, but after Margot explained to me it was one of the 4 types of APRNs that blended direct patient care, had a large focus on quality improvement, outcomes, and research, I was all in. In fact, I applied shortly after that here at the University of Minnesota. Maybe I was young and easily influenced, but it really felt like it was the right move. And I had a great deal of respect for Margot. I thought if she saw this in me, maybe there was something there, and maybe, just maybe, I could do it. Margot became one of my mentors. I ended up graduating and becoming an adult health clinical nurse specialist. I never thought that I would leave that cardiac unit. It was really special to me. But again, I took a chance on where my journey was taking me, and I said yes. Fast forward several years, I received a phone call from another leader who was another mentor of mine. Her name was Mandy. She let me know about an open nurse manager position. She was also a CNS by background and had just stepped into her first chief nursing officer role. I really did not know much about the nurse manager role, other than seeing what Mary, my first manager, did. But I trusted Mandy, so I applied, went through the interview process, and ended up getting that position. I was a nurse manager for about 5 years, and then I held multiple different director positions after that. Then, about 4.5 years ago, I received a few phone calls about a CNO, or chief nursing officer, position that was open at Methodist Hospital. I was incredibly honored and very humbled. However, I really did not think I was ready for the CNO position. I thanked those that called me, but I said, I'm not ready. After I received a few more phone calls and held several conversations with people that I trusted and respected, including Mandy, I ultimately applied. After I did apply, I called another one of my mentors, Kathy Wild. She and I were matched through a formal nursing leadership mentorship program. Kathy was absolutely fantastic. She helped to boost my confidence and helped me prepare for a very daunting interview process. After several interviews, actually 11 to be exact, I was lucky enough to get that position. And now I'm lucky enough to be here today with all of you. I could not have done it without the inspiration, the encouragement, and the support from my mentors. So what does the future look like for you? You, the class of 2025, you are the future of nursing, and we need you now more than ever. We are living in a defining moment for healthcare. The world has been forever changed by the COVID-19 pandemic. We're witnessing rapid transformations in technology, population health needs, healthcare policy, and equity. And through all of it, the heartbeat of care has remained, and that's nursing. I have boiled it down to 4 things: that we and nursing are going to need from all of you. First, we need your vision, because healthcare is at a crossroad. We are facing a global shortage of nurses. There is mental health crises across all ages. There are persistent health inequities, and there's an aging population with incredibly complex needs. We cannot afford to wait for change. We need you all to lead it. Second, we need your voice, because policies made by those who show up. Nurses are often trusted more than any other profession, yet we're often underrepresented in the places where decisions are made and where our voice is really needed. Whether it is with one of our legislators on research panels or in boardrooms, your voice must be heard. The third one, we need your innovation, because the old models of care are not sufficient. Telehealth, AI, and community-based care are changing how we reach and how we care for communities. As nurses, we are uniquely trained to think holistically. We don't just treat our patients' symptoms or their conditions, we treat the whole person. That perspective is needed as we design systems to support our patients and healthcare systems moving into the future. And fourth, we need your compassion, because this work is really hard. Our healthcare workforce is burning out. Patients are often scared and they're vulnerable. Families are overwhelmed. What you all bring is the empathy and the listening and your healing presence. Nurses are lifesavers and fierce patient advocates. You are often there when no one else is. You get to be there for them in their most vulnerable times, and that is a privilege. I remember losing my first patient. His name was Dean. He had an aortic valve repair. He was a proud husband, a proud dad, and a very proud grandpa. He had pictures of his grandkids that lined the windowsill of his patient room. I had him for several shifts in a row, so I got to know him really well. Unfortunately, one day, he threw a PE and he coded. He didn't make it. I remember sitting with his family afterwards, and we all wept. No matter if it's your first time losing a patient or it's your 10th, it's never easy. I share this with all of you as new graduates to prepare you. There are going to be hard times, and in those times, that is when you guys get to step up and you get to embrace that privilege of being a nurse. You get to be side by side with your patients and their families when they're scared and they really need someone. And there's going to be the really happy moments when you see a patient that you've been working with for some time finally leave the hospital. You get to see them walk out the door with their families, and you know that your expertise, your skill, your compassion, you help them on their path to recovery. As you may have gathered, I'm no longer directly at the bedside. However, I often reflect on my first few years in this profession. I'm grateful for the connections that I've made with my patients. One of my patients that will always remain in my heart and mind was when I was in my first year of practice. I had a bit of a challenging day, and I was up for first admit. Little did I know that that admit would be a patient that would leave a lasting imprint on me. Her name was Betty. I had Betty for a few shifts in a row, and we quickly connected. We both had a passion for baking, and we talked at length about our favorite recipes. I shared that I love banana bread, and I was really trying to perfect the recipe. On the day of discharge, Betty had a friend bring in her recipe card, and she gave me her infamous banana bread recipe, and I still have that card to this day. On Betty's day of discharge, she thanked me for everything, and I thanked her for again reminding me of why I do what I do. We hugged, and then she left. When I have tough days, and you all will, unfortunately, I intentionally bring myself back to that day to remind myself of the significance of nursing and how important nurses are in patients' lives. You will all have many patients like Dean and Betty that will shape who you are as a nurse, who you are as a professional, and who you are as a person. And this is the privilege of being a nurse that I've been speaking to. Before I wrap up, I'd like to share with you all 5 key lessons that I've learned over my almost 20 years in nursing. These are lessons that I've learned when I've made mistakes, when I did things well, and lessons I've learned from my mentors, other nurses, and leaders. The first one, stay curious. Never stop asking questions and never stop learning. Our profession thrives on inquiry. Keep asking those questions and asking yourself, how can I improve as a nursing professional and as a leader? Present your work, your projects, your research. Be the voice that we need. Number 2, say yes. There are going to be opportunities for you. There are going to be the people around you that see your potential. Don't be afraid to say yes. Will there be times where you get it wrong? Absolutely. This is how we learn, and this is how we grow as professionals. There is a quote that was shared with me by one of the past leaders, my past leaders. Sometimes you win, and sometimes you learn. Number 3, find a mentor. They are an invaluable resource to you. They can be your sounding board, and most of all, they want to see you succeed. Build your network. As you get started on your journey, also consider mentoring others and sharing your gift. Number 4, listen more than you speak. When connecting with patients, ensure that you're sitting down with them, you're at eye level. Listen to their concerns, listen to their fears. A physician once shared with me, he said, "Melissa, this is the best question you can ever ask a patient." He said, "If tomorrow you could press pause on one worry about your health or worry about going home, what would that be?" So again, listen more than you speak. And if you are leading teams or on projects, sit back and let the team speak, let them dialogue, give them the space to connect and create the magic. We can learn so much from listening to others. And number 5, embrace resilience and your well-being. In our profession, there will be moments of challenge, whether that is a tough patient situation, a challenging shift, research or project deadlines. What matters most is how we respond to those challenges and how we bounce forward and not back. Please also remember to take care of yourselves in the process. Set boundaries, take your breaks. Take breaks off the unit, take breaks out of your office. Make time for your family and your friends, and prioritize your well-being. So, as you walk across this stage shortly, I want you to remember that you are not just entering a job, you're entering a calling. The world of nursing will challenge you in ways you have never experienced, but it will also reward you in ways you cannot yet imagine. Nursing is a true privilege. On behalf of all of us who have dedicated our lives to nursing, I welcome you to this extraordinary profession, and I thank you for answering the call. So, go be there for the Bettys and the Deans, and find your Mandys and your Margos of the world. Congratulations, class of 2025. We see you, we celebrate, and we believe in you. Thank you.
Thank you, Melissa. I want to particularly thank you, and I'm deeply struck that your career trajectory is exemplary of, even in your exec role, the patients and families are your beacon. Thank you. And now it's my pleasure to introduce today's student speaker from your class. Satha graduated with a Bachelor of Arts degree from Macalester College, and then went on to earn a Master in Public Health degree from the University of Minnesota. Satha applied her public health training working as a senior epidemiologist at the Minnesota Department of Health. And then she started the Master of Nursing program. Satha's main focus as an epidemiologist was on population-level immunization rates, and she also supported Minnesota's COVID-19 response efforts. She served as an on-call epidemiologist and served numerous other roles supporting the health of Minnesotans. Please join me in welcoming Satha.
First of all, thank you to my family, my friends, my teachers, and my classmates. All of you have taught me, supported me, listened to me rant, and made me laugh throughout this program. I am grateful for you all. I want to take this opportunity to celebrate our entry into the field of nursing. Specifically, I want to both challenge and celebrate a word that is often used dismissively about the nursing profession: softness. Soft is a term used frequently for skills that are part of the supportive, educational, or caring professions. Soft, as opposed to hard ones, like lab science, research, construction, or engineering. Soft gets conflated with easy. I mean, how hard can nursing be? It's just patting someone on the back and telling them it's going to be okay. It's just assessing wounds, monitoring bleeding, titrating medications, monitoring lab results, and reading complex orders. It's just reading between the lines in a patient's history to determine whether an injury is due to accident, domestic violence, or to self-harm. It's just de-escalating dangerous situations with dysregulated and sometimes violent patients. It's just caring for 4, 5, or 6 patients at a time. It's just learning the difference between a judicial warrant and an administrative warrant so you can protect your patients from an illegal kidnapping in case one takes place at your facility. It's just standing up for patients as Medicare and Medicaid are cut, research is defunded, vaccines are demonized, and medical misinformation runs rampant. Soft is a dismissive word. It's a gendered word, meant to put the skills of caring, support, and education in their place behind those hard skills. Look, I earned a master's of public health right here at the University of Minnesota, where I learned the hard skills like research methods, statistics, and systems analysis. After getting this degree, I worked as an epidemiologist, and I practiced the hard sciences of microbiology and disease investigation. But after working through 2 global pandemics, I can tell you that those soft skills are just as difficult to acquire and to use as any hard science. My past career taught me that numbers can tell the story of a disease, but it takes hands-on work and a caring heart to help people heal. Nursing is hard. It is a profession backed by rigorous scientific inquiry and evidence-based practice. It involves the practical application of science, and it involves explaining that science to a patient after the doctor leaves the room with questions unanswered. But nursing is also soft. Nurses have to be soft. They have to be soft enough to cradle a postpartum patient while they sob and shake after giving birth. We must be soft enough to support parents who are processing a terminal diagnosis for their child. We are the voice encouraging a patient to take their first steps after a major surgery, the hand helping them stand strong. Caring as a profession is demanding. It is big and all-encompassing and will occupy our hands, our minds, and our hearts. Caring will help us stand up to a healthcare system that prioritizes profits over patients and shareholder demands over the needs of frontline staff. Caring is a radical act. When performed with compassion and justice, a nurse's care can bring a patient out of despair and towards a path to recovery. Care helps nurses combat profit motives and advocate for evidence-based care. I have faith in us. I have faith in the nurses that came before us and the nurses who will join us in years ahead. We are relentless in our caring, stubborn in our advocacy, resolute in our actions, and ready to use our hard-won skills, the hard ones and the soft ones, to build a better, healthier world for all of us. Thank you.
Thank you, Sutta. I think you're teaching us that the bridge between soft and science might be the sacred. Now we welcome the president of the School of Nursing's Alumni Society Board, Dr. Savannah Zins. Savannah is a nursing education specialist at Mayo Clinic and assistant professor of nursing at the Mayo Clinic College of Medicine and Science. She holds a PhD from the University of Minnesota and has extensive clinical and education experience. And she has been instrumental in enhancing the professional growth of clinical nurses and improving patient care through her educational initiatives. Recognized for excellence in patient care, research, and education, she is dedicated to advancing nursing practice and fostering the next generation of compassionate, skilled nurses. Please welcome Savannah Zins.
Thank you, Dean Delaney. As president of the School of Nursing Alumni Society Board, it is an honor and pleasure to stand before you today to offer congratulations from the Alumni Society. The board was created in 1913, and its longevity is a testament to the strength of our nursing graduates. In the spirit of this lifelong learning, recognition of your current achievements, and hope for many future contributions to the nursing profession and to the School of Nursing Alumni Society, we are pleased to welcome you as our newest alumni. The School of Nursing Alumni Society is pleased to present each of our pre-licensure graduates with the University of Minnesota School of Nursing pin. It's made possible with donations from the Nursing Annual Fund. The pinning ceremony is a nursing tradition that goes back more than 100 years, where new nurses are presented with the school's pins by the faculty. It represents a symbolic welcoming of new graduates into the nursing profession. The School of Nursing pin has been given to all initial licensure graduates at the University of Minnesota since 1913. You can learn about the School of Nursing pin symbols in your commencement program. And to our doctoral graduates, we present to you a University of Minnesota School of Nursing embossed journal to celebrate your professional achievements. Moving forward, we invite you to all stay engaged with the University of Minnesota community. Come back to campus when possible, serve as a mentor, become a preceptor, and attend our events, including our all-school reunion in the fall. Please stay connected with the School of Nursing through social media and be sure to let us know where you are and what you are doing. As our newest graduates, you represent both the future of nursing and the School of Nursing's legacy. Graduates of the class of 2025, you make us so proud. Congratulations.
We thank you, Savannah, for being an alum and all the service that you provide through being on the board. We are pleased to welcome Honorable Regent Robin Gully. She will join us for the formal conferral of degrees. So class of 2025, please welcome Regent Gully.
I am honored to preside over this commencement on behalf of the University of Minnesota Board of Regents. I'd like to extend my congratulations to the graduates. The power of higher education that you've received will shape the trajectory of your career. You have learned so much from your fellow students, many of whom are seated next to you today, and of course from the faculty who have taught and mentored you. This education, along with the stamina you've built from long hours of study and your lifetime commitment to continued education, will serve you and your patients well. Today, we honor your efforts and accomplishments with a celebration. Through hard work and determination, you have earned this day of recognition. Now more than ever, our healthcare system needs highly qualified nurses. We not only celebrate your academic achievements, but also your potential to deliver a positive influence on the professional healthcare world. Wear your University of Minnesota nursing degree proudly as you begin this journey, contributing to your communities, to the state of Minnesota, the nation, and even to the world. To all the family and friends joining us here today, thank you for the countless ways you've supported these students as they've earned their nursing degrees.
Thank you, Regent Gully. And now at this time, if you can please feel free to stay with me if you'd like. At this time, we'd like to invite the graduates to please rise as you are able. So Regent Gully, on behalf of the faculty of the School of Nursing, I present to you these candidates as having completed the requirements for the Master of Nursing and Doctor of Nursing Practice program.
Thank you, Dean Delaney. Upon the recommendation of the faculty and by the authority of the Regents, I now confer on you the degrees to which you have qualified. On behalf of my colleagues and the University of Minnesota Board of Regents, I extend a warm congratulations and best wishes for your success. Thank you.
Yes, you can celebrate. We now invite our Master of Nursing graduates to come forward for the presentation of diplomas and pins. Associate Dean for Academic Programs, Professor Susan Gross-Veneris, will read the names of the graduates, as Carol Flaughton, Clinical Professor and Assistant Dean for Pre-Licensure Programs, presents the Minnesota Masters of Nursing grads with their School of Nursing pin. She'll be assisted by Savannah.
Ariana Ackerman. Aisha Ali. Edna Ali. Nadine Ifashagun Ashby. Bridget Ashley. Sashimta Bhagavati Raj. Abby Bangasser. Claire Binneker. Rachel Boleg. Catherine Brown. Annabella Call. Christopher Cuellar. Mimi Dow. Chloe Ingelges. Celia Erickson. Zachary Faith. Chloe Fedderson. Afifa Fayiso. Emma Gamback. And Bella Herr. Jessica Hing. Samuel Hopkinson. Parvanye Jefferson. Eden Zhang. McKenna Johnson. Katie Kemick. Rachel Kretschmar. Analia Kroonblad. Libby Lebowski. Kylie Larson. Allie Lay. Lauren Lockhart. Anique London. Leah Merrick Pester. Catherine Massell. Carter Mulder. Emily Mulhern. Catherine Murney. Julia Nathan. Christy Nguyen. Kaya Oxendorf. Ryan Paddock. Anna Pentacuff. Madison Peterson. Mia Piccone. Lexi Ranitsky. Bridget Ryan. Theo Salzberg. Aaron Sather. Justine Shaky. Sudha Seti. Danica Sabachin. Samantha Spatafor. Langdon Staley. Summer Stroshine. Alexandra Suvimoon Temereth. Emily Weber. Ella Winnicky. Hope Wiley. Jen Zimmer. We now invite our Doctor of Nursing practice graduates to come forward and receive their diplomas. DNP graduates will have their doctoral hoods placed over their graduation gowns. Hooding will be performed by Dr. Stephanie Delkowski, Clinical Associate Professor and Assistant Dean of the Doctor of Nursing Practice Program, and the graduate's project advisor. The title of each graduate's Doctor of Nursing Practice project can be found listed in the program. Health, Innovation, and Leadership, Jennifer Tucker, hooded by Dr. Stephanie Gingrich. Letitia Canale, hooded by Dr. Stephanie Gingrich. Carolyn Fitzpatrick, hooded by Dr. Judy Pekacik. Jalen Sanaya O'Berry, hooded by Dr. Judy Pekacik. Brittany Smith.
Please join in congratulating all of our graduates one more time.